We begin with our top story tonight. The CDC has signed off on its recommendation to allow those 12 and older to receive the Pfizer vaccine.
That the benefits far outweigh the risks. I think this will provide protection for 12 to 15-year-olds.
So what do parents need to know? I spoke today with the Division Chief of General Pediatrics at Loma Linda University Children's Hospital, Dr. Alexandra Clark. Dr. Clark, let me start by asking you about today's announcement. The CDC is giving its recommendation to distribute the Pfizer vaccine to those as young as 12 years old.
We are thrilled. It's something that we've been waiting for in our pediatric community for so long. Really looking forward to this day where we can really start to protect that next age range of our population so that our children can get back to normal activity, get back to school, and to the things that they do to keep them healthy and well.
Why do you think this is so important to expand that eligibility?
I think there's a few things to think about. One main thing is that absolutely we've seen the emotional impact and toll, the learning impact on our children and youth during this pandemic. And while, keeping distancing has been a critical element in decreasing death, it has really taken an emotional, impact on these children. We need to get them back to where they can be healthy and do these activities. And secondly, we know that children, we've been fortunate that they have, really suffered a lower level of overall burden of disease, overall through this pandemic. But they also have that risk of that multi-system inflammatory syndrome in children after. And we don't know which child. We know some of the risk factors, but we don't know all of the things that might be your child that might be impacted versus not. And so it's sort of like Russian roulette, right? So we don't want that for our kids. We want to protect them. And we also know that kids spread disease at that age as effectively, if you will, as frequently as older adults. So as we get them back to their activities, if they're infected, they're more likely to infect those around them and even bring that back to their home, which we want to really prevent.
Will children receive the same amount of dosage that adults receive, and will the vaccine be just as effective as it is for adults?
Yeah, so in this age range, the 12 to 15-year-old range, it is the same dose. It is the same 2 doses. We're only talking about Pfizer in this instance. We're still waiting for some of the other manufacturers who are doing clinical trials in different age ranges to come out, but today's announcement's Pfizer. And so it is the same dose. Other doses might be different for the younger ages as we get to that point, but today it's the same. Efficacy has been amazing. They have seen that this vaccine is as efficacious, if not more efficacious, in preventing both disease and severe disease in these children. And the side effects are really minimal. Couple days, if the most, of their second vaccine, having some of those fevers, body aches, those things we don't love, but definitely a lot easier to handle. A couple days of feeling a little bit less than perfect compared to having severe effects of the disease.
We keep hearing that children are not as susceptible to getting sick from the coronavirus compared to adults, especially older adults. So for folks who may be wondering, why should they get their children vaccinated if it's really not that big of a threat to them?
Yeah, so great. I mean, we definitely have this question asked to us quite a bit, and it really goes back to a few main things. Like I said, some kids are not as sick as the adults. There's a lot of more asymptomatic children, but at the same time, some children are becoming sick. Some children are dying. And this multi-system inflammatory disease of children that's happening 1 to 3 weeks after even asymptomatic COVID infections is the thing that's really being a burden to children, putting them in the ICU, causing long-term cardiac, kidney, long-term effects that we don't even fully understand how long that's going to be for them. We want to prevent that for all our children since this vaccine is available, safe, effective. 2 injections, a little bit of discomfort at your arm is a lot better than playing with fire and potentially having a child that ends up with a bad outcome for their heart or lungs long term. They're so young. Let's protect them. Let's get them protected. But then the next big thing is protecting our community at large. There is a subset of people based on their underlying medical problems that cannot get vaccinated, right? People undergoing chemotherapy, people with immune system issues, certain things that those population need to chat with their doctor before signing their child up for the vaccine. But if we can protect a bigger bubble, we've heard a lot about herd immunity and we're not reaching it because we still have some people just not really sure yet what they want to do. And I would encourage them to have good conversations, with their providers to understand the thing that's holding them back.
Dr. Clark, we appreciate your time. Thanks for joining us.
Anytime. Take care. Thanks so much, Peter.